Hey guys, Dr. Andy here. Today I want to talk about why we may want to increase stiffness in a joint. And I know that kind of sounds crazy because when you think of a chiropractor, especially with most of our patients, we are talking about how we are trying to find stiffness in a patient when they first come in and then reduce that stiffness and increase mobility. And typically when we increase mobility, we're able to kind of help with a lot of your symptoms. However, that's not for everyone. A lot of people come in with hypermobility, and that can actually be a huge problem. Take, for instance, me, for example. My two biggest injuries have actually been because I am a kind of unstable sometimes. Well, that kind of came out wrong. But the joints themselves are actually unstable, right? So there's too much range of motion. There's no rigidity. There's no stiffness in the joint. And as a result, I hurt myself. Last spring, for example, I hurt myself front squatting. It took me like 6 to 9 months to recover from the injury into the shoulder, and it's probably still there. And everything that I have done since then has been to increase stiffness in the joint so that I don't hurt myself again. All right. Just this past week, I hurt my wrist, and it's because I'm hypermobile, right? So when I extend too far, there is no stiffness in the joints. It's hypermobile. There is instability in my wrist. And whenever that happens, it does increase the likelihood of hurting yourself. And for me, it was actually an extension-based injury through my right wrist. So when we have patients come in, it is important that we do evaluate them for, is this a problem that you have not enough movement, right? Which is most common. It actually is when we have too much stiffness, or we don't have enough stiffness. That's actually a motor control problem or a stability problem. And obviously the treatment is different for each individual. Someone like me, I don't need a lot of mobility work. What I need is, I need a lot of muscle strength training, right? So I can increase my motor control, increase my stiffness, increase the rigidity in my joints, especially the big kind of flexible ones like my shoulder and like my wrist and elbow, right? And obviously with the other patients, we want to increase mobility with stretching exercises, spinal manipulation, or anything like that. So just kind of depends on the type of injury you have, or the type of person, or your specific mobility patterns. All right, so if you found this interesting and you have any questions for me, send them my way. Always remember to live with passion, not pain.